Hello, everyone. I'm Frances Cassidy, MC of today's webinar, and I'm from GCI Health, the communications agency supporting the Asian Development Bank's Southeast Asia Development Solutions, the EU-ASEAN Business Council, and Sanofi on an initiative entitled Life Course Immunization for Older Adults in Asia, a Health Economics Case. It's a pleasure to have you all here today. Before we begin, I'd like to remind everyone to please put yourself on mute, unless, of course, you are speaking. So, following our first webinar, which was held on the 26th of September and introduced this initiative, we were delighted to see the response from students, academics, and other professionals in the field, and it's extremely inspiring to see the multitude of ideas that have been submitted since. Before we go ahead, please allow me to introduce each of our panelists today. Dr. Benjamin Coughlin, Senior Health Specialist for Health Security at the Asian Development Bank. Professor Zambari Sakawi, Professor of Medical Microbiology and former Dean at University Putra Malaysia and Chairman of the Malaysian Influenza Working Group. And Chris Humphrey, Executive Director at EU-ASEAN Business Council, Director at Crowell and Mooring International and Asia Pacific Economic Cooperation Vaccines Task Force Representative. And last but not least, Ada Wong, Head of Public Affairs for Vaccines, Asia JPAC at Sanofi. We're excited to hear more from our experts across public health, policy, and academia sectors today as they discuss the value of life course immunization, especially for the elderly population in Southeast Asia. To kick us off, Dr. Benjamin Coughlin from the Asian Development Bank will open today's program. Ben is a public health physician and medical epidemiologist with 17 years of experience in Asia and the Pacific, focusing on strengthening health systems to address major public health challenges, including emerging infectious diseases, antimicrobial resistance, and undernutrition. Ben, over to you.
Thanks very much, Frances. Look, I'm really thrilled to be here today to join this webinar to witness the unveiling of these submissions, because this is a vital issue for Asia Pacific and for the Asian Development Bank. And when we look around after COVID, we see that government-led immunisation programs, while almost universally have addressed women and children, they've been far less comprehensive in addressing the older population. However, many countries are now beginning to look at this and to decide if this is an investment for them for genuine life course immunisation programs. So at ADB, we're seeing a convergence of a number of health issues here, which I think are all actually bolstering the case for governments to invest in whole-of-life immunisation. And the first issue that's converging really is that COVID has taught us the value of strong health systems, especially immunisation systems, for rapidly delivering medical countermeasures to pandemics. So you can't do well unless you have an existing strong preventive healthcare system. And one example of that in Asia Development Bank's countries was in Bhutan, so highly mountainous region, logistically challenging to deliver vaccines, but able to achieve a high coverage very swiftly and ended up with one of the highest vaccine coverage of COVID vaccines in the world. And that was testament to the strength of their existing immunisation programs, including having a number of antigens for adults. The other issue we're facing is a rapidly ageing population across Asia and how we sustain healthcare models that we can fund in the long term to deliver quality systems. So in Asia, by 2050, I think the latest estimates of the population of older adults, so over 60 and above, will be something like 1.3 billion people, and most of those are currently not receiving much preventive healthcare at all. So when we look at developing countries in our region, we see the potential value of preventive healthcare through immunisation programs in terms of averting disease, averting costs to health systems. The other thing emerging out of COVID, and I think really shows us the value of webinars like this, is this idea of new partnerships. We are talking to new people. We are joining up academia, industry, and the public sector to realise much greater health gains. And this webinar for me is really all about filling these knowledge gaps and these no-do gaps, so where we do have evidence of good cost effectiveness of certain public health interventions, how do we implement them across the many different settings in Southeast Asia and beyond? And as a bank, we really rely on that kind of information to decide what are the best buys for us, where do we put our money, where do we yield the best health dividends. So this is incredibly valuable, this kind of initiative, so that we can decide how best to support vaccine programs for older adults. So very excited to hear from the keynote speaker and to hear from the other submissions. So thank you very much, and all the best for this webinar.
Thank you, Ben. Now let's hear from our keynote speaker, Professor Zambari Sekawi. He's a professor of medical microbiology and former dean at University Putra Malaysia, with significant contributions to medical education, research, and infectious disease issues. He's also a passionate advocate for enhancing adult immunization efforts in Malaysia. Now, unfortunately, Professor Zambari couldn't be here today, but we are delighted to share his recorded message where he speaks about the importance of prioritizing life course immunization as part of an economy's healthy aging strategy. In particular, he will feature a case study on moving the needle on life course immunization in the region, Malaysia's example of setting up the Older Persons Subcommittee, as well as developing the position paper for influenza prevention in the elderly by the Malaysian Influenza Working Group, including how these initiatives have impacted outcomes. So let's hear from Professor Zambari now.
Hello, everyone. My name is Zambari Sekawi. I'm the chair of the Malaysian Influenza Working Group. And today, I'm going to share my experience on the Malaysian experience in prioritizing life course immunization as an important pillar of healthy aging. Malaysia, by the year 2040, will become an aged nation, which means that 40% or more of our population will be aged 65 and above. And at the moment, we are an aging society, which is about 7.3% of our population age 65 and older. Well, it's well known that age 65 and above is an independent predictor of hospitalization and death, and similar is the case in Malaysia. In a study involving low to and middle income countries, immunization programs were found to be the most cost-effective interventions to protect against any infectious diseases. In this case, it returned about $51 for every $1 spent. And flu vaccinations among these elder persons were found to yield cost savings of approximately $15,300 per quality adjusted life years gain in countries reported in the United States. Influenza is still a problem in Malaysia, as you can see from this surveillance information here in GISRS, whereby post-pandemic, since year 2022, there is a surge in influenza in the country. And there were many news reports about cases of influenza outbreaks and so on, and the highest clusters were reported in primary and secondary schools. Influenza vaccination rate in Malaysia remain very low because there is no adult immunization program, and less than 2% of the population were vaccinated for influenza. Ministry of Health Malaysia indeed recommends adult vaccines, but then the immunization expenses are financed out of pocket almost entirely, and therefore is found in the private sector. Latest study concluded that about 5.5% of elderly were vaccinated for influenza in Malaysia. As you can see here, how did Malaysia fare with the other ASEAN countries? We are indeed, the coverage is low, and we compare to other countries like Thailand, Philippines, and Singapore. We cannot compare with other developed countries like South Korea, Taiwan, and United Kingdom, whereby they have a very high uptake of the influenza vaccines. Why is this so? This happened because in Malaysia, we don't have a government reimbursement system for adult vaccines. As you can see, they are available in other ASEAN countries. But we do have tax exemptions up to 1,000 ringgit per person to cover vaccination expenses for vaccines like pneumococcal, influenza, and COVID-19 vaccines. And hence, the Malaysian Influenza Working Group, which is an interest group under the Malaysian Society of Infectious Diseases and Chemotherapy, we aim to work with the Ministry of Health and all relevant stakeholders in enhancing the prevention, management, and also the control of influenza in Malaysia. So this group, which I chaired, consisted of a very diverse group of virologists, physicians, pediatricians, infectious disease specialists, geriatrician, and also chest physician. In this working group, we also established the older person subcommittee, which was chaired by a geriatrician. And from this subcommittee, we come out with a position paper on flu vaccination in elderly. We highlighted the fact that there are poor outcomes among the elderly 65 years and above, and those with significant comorbidities. The elderly accounts for significant influenza-related hospitalizations and also death. And flu vaccines indeed reduce the incidence of pneumonia and hospital admissions, as well as reducing the risk of mortality by 25%. And we should not forget also it reduces admission rates of stroke and heart failure. And therefore it is recommended to those age 50 years and above and to be taken annually. And this position paper was supported by 32 medical bodies and NGOs. There were numerous public education in the news, in TV, radio, and also social media, highlighting the fact that the need for the vaccine, especially for elderly. And we also did some research, and these are some of the papers done by MIWG. And this is the latest papers on a cross-sectional study of influenza trends and cause in Malaysia. We found out that about 15% of laboratory confirmed cases from ILI or influenza-like illness are indeed influenza. And it costs us a lot in Malaysia, about $65 million US. We launched the guidelines for prevention of influenza in older persons back in June 2023 to be used by our healthcare professionals and doctors. And there are 10 key recommendations here. All persons aged 16 and above should get influenza vaccines, and also highlighting the fact that they can use any available vaccines available in their country, and post-exposure prophylaxis with antiviral agents should also be considered. And there are some statements also on residents of aged care facilities and also the staff working in these facilities. Additionally, we also formed the Malaysian Alliance for Prevention of Influenza. This is to get the buy-in from the medical and non-medical professional societies to help us in enabling access to influenza vaccination for high-risk groups. So we have managed to get around more than 30 NGOs and also medical societies. We started aggressively with petition campaign and all that to get the government to actually support and provide free influenza vaccination for the elderly. And indeed, from the petitions, we are now in the process of tabulating the results and to be shared with the Ministry of Health, the press, and also the Parliament. Just to inform you, last week we have met the Parliamentary Select Committee on Health, indicating to them that we would like to have a government-funded flu vaccination, and they were very supportive. Also, we will write an open letter to the Health Minister and also intensify our media publicity campaign. Now we are seeing some light at the end of the tunnel. Now, Ministry of Health are starting to talk about providing influenza vaccination to the public, especially those at risk. More so now that Malaysia is producing its health white paper. And from there, there's actually a new shift of focus from curative to preventive. So that is why MRW has been very vocal in terms of advocating vaccination and taking this opportunity to get the government-funded flu vaccination. So in conclusion, the group has been very passionate in in preventing influenza among these high-risk groups and the elderly. And we are moving towards intensifying more and more campaign in order to convince the Ministry of Health to provide this vaccination program. So thank you very much for your kind attention.
Thank you to Professor Zambari for his presentation. And now it's time to announce our best submission. And I'm sure it wasn't an easy decision for our judges, who were Professor George Godsadze, President of Curatio International Foundation, Lois Privor-Dung, Director of Adult Vaccines at the International Vaccine Access Center at Johns Hopkins Bloomberg School of Public Health, and Chris Hardesty, Independent Health Economist. I would now like to invite one of our panelists, Chris Humphrey, who will announce the Best Submission Initiative. Chris, over to you.
Thank you, Francis. I think Professor Zambari's case study was very interesting indeed, as it highlights the importance of prioritizing life course immunization as part of an economy's healthy aging strategy. The example of setting up the older person subcommittee, as well as developing the guidelines for influenza prevention in the elderly by the Malaysian Influenza Working Group, is definitely a good learning for us right across the ASEAN region. As we've been highlighting, life course immunization is a very important aspect of healthcare economics as a whole. It not only minimizes the severity of infectious diseases, but also reduces comorbidities and helps create more sustainable healthcare systems. As Saba mentioned earlier, we've seen in the past that the childhood vaccinations have been and still are strongly promoted. But following the pandemic, immunization throughout the course of one's life has become an increasingly important aspect for the healthcare systems to take into account. It is great to see the progress made in the region in terms of preventative healthcare programs like life course immunization. However, we are also seeing that despite the benefits for both healthcare and the economy, the vaccine uptake rates in the region still remain below the target of 75% set by the World Health Organization. This means that there are still some challenges that need to be overcome in order to implement successful elderly immunization programs. And this is where the ideation initiative comes in. Our objective is to encourage the understanding of the value of life course immunization, especially for the elderly, and inspire the next generation of healthcare talent to solve the critical gaps in healthcare and propose innovative healthcare financing models to expand immunization programs to include the elderly. That's why it's a pleasure to have you all here today, and I'm very excited to announce that the best submission for this ideation initiative goes to Christine Chong of the Rising Stars category, who focused on life course immunization discussions in Singapore. We have also received good submissions in the working professionals category, but the judging panel was not able to shortlist the best submission from this category. To all the participants, the hard work that you have put into your initiatives is very much appreciated, and we thank you all for taking part in this important initiative. And with that, I will hand over to Christine Chong to present the best submission. Congratulations, Christine.
Thank you, Chris. Good afternoon, all. I'm Christine, and I'm a third-year student at Singapore Management University, majoring in economics and health economics and management. I'm very delighted and honored to be here today to share with you about the significance of increasing uptake rates for life course immunization in Singapore. And this will be the rough breakdown for today's presentation. For life course immunization landscape, I'll be looking at the prevalence for both influenza and pneumococcal disease, existing vaccination programs, and vaccine uptake rates. After that, I'll cover benefits of life course immunization, which includes the direct cost benefits of influenza and pneumococcal disease. Then, before discussing the innovative methods of funding outsource, I'll talk about the government's expenditure and strategies. Lastly, ending off with measurement of impact by looking at feasibility, impact, overall outcome, and cost effectiveness. Let us first look at the prevalence of pneumococcal disease in Singapore. First, from 1995 to 2004, we have the mean annual hospitalization rate at 56.4 per 100K population for those aged 65 years and above, with pneumonia being the fourth most common cause of hospitalization. Next, mortality rate at 3.2%, with pneumonia being the second leading cause of death. There is also an additional point that I would like to draw your attention to, and that would be the coincidence of the increase in both the annual hospitalization rate and the incidence of penicillin non-susceptible pneumococcal disease. Penicillin non-susceptible once again stresses the importance of vaccination. As for influenza, the table on the right shows that the estimates for influenza-associated proportion of deaths for those aged 65 years and above was the highest in Singapore as compared to Hong Kong and United States. For diabetic patients, flu results in increased rates of clinic visits, hospitalizations, and deaths, as these individuals are 6 times more likely to be hospitalized in cases of influenza epidemic. Influenza vaccine efficacy for those aged 65 years and above is also estimated to be 68%, and has been proven to greatly reduce influenza and diabetes-related hospitalizations for diabetic individuals. This brings me to my next section, where we get a clearer idea of the existing policies that are in place to encourage the uptake of vaccines. First, we have the National Adult Immunization Schedule, which aims to prevent infections among susceptible individuals, with the ultimate goal to reduce complications, morbidity, and mortality. There are also enhanced subsidies so that vaccinations are more affordable and accessible at CHAS GP clinics and polyclinics, which I will elaborate further in a short while. However, not to mention that only eligible Singaporeans get to enjoy these subsidies. Next would be a Healthier SG. It is a new national initiative that focuses on preventive health. And precisely because it's new, the government will send out SMS invitations progressively to eligible individuals for them to enroll with a participating Healthier SG clinic or polyclinic. There are 2 ways of enrollment. First, one can enroll directly using the Health Hub mobile app or the web portal. However, not forgetting that some of our elder populations, they are less tech savvy. So there is also assisted enrollment, where enrollment can be done on-site at places such as community clubs located around Singapore. And moving on to the highlight of this initiative, national recommended vaccinations under NAIS, as previously introduced, will be fully subsidized for eligible Singaporeans enrolled. Expanding on the enhanced subsidies of NAIS, I would like to share more about the extent of subsidies for different eligible Singaporeans. As mentioned, eligible individuals can get subsidized vaccination at 2 locations: GP clinics that are involved in the CHAS program, as well as government polyclinics. So let us first look at the CHAS GP clinics. Eligible Singaporeans get to enjoy higher subsidies for nationally recommended vaccinations listed on the subsidized vaccine list at GP clinics that are involved in CHAS programs, which of course also covers other vaccinations besides influenza and pneumococcal vaccinations that are included as an example in the table. The tiers of subsidies is classified using 2 indicators. First, age group, and the other would be household income. From the table, we can tell that the elder population gets to enjoy the greatest amount of subsidies. And as for Singaporeans who wish to visit polyclinic for their vaccination, They can also get up to 75% subsidy for NAIS vaccinations. Pioneer Generation and Merdeka Generation seniors also get an additional 50% and 25% subsidy on top of their subsidized vaccination bills, respectively. If there is any remaining co-payment left, one can also choose to utilize their MediSave or even Flexi MediSave for recommended vaccinations under NAIS if eligibility is met. However, even with these measures in place, pneumococcal and influenza vaccination rates for individuals aged 65 years and above still remains low at 6.1% and 32.4% respectively. From a study conducted, this could be due to existing barriers, which includes low awareness, uncertainty about the vaccination need, and insufficient recommendations from healthcare workers or experts, which has resulted in missed opportunities for individuals to be vaccinated. Therefore, to bridge the existing knowledge gaps, measures suggested by researchers include invitational brochures, improving the accessibility, clinician reminders, and information dissemination on available subsidies. So with the limited amount of data for pneumococcal disease in Singapore, I chose to reference to the hospitalization costs in countries such as United States and Australia. If we were to refer to the upper half of the slide, this study conducted in the United States extracted costs incurred at different phases of disease treatment. And a point worth highlighting would be the third point, where costs attributable to CAP, community-acquired pneumonia, are the highest among patients aged 50 to 64 years, with those aged 65 to 74 years ranked third. And as for the lower half of the slide, we observed that the estimated annual cost of treating pneumococcal pneumonia hospitalizations and GP clinics at around 56K and 1.6K Australian dollars respectively. And the cost of invasive pneumococcal disease is estimated to be around 1.2 million Australian dollars. Now, looking at the direct cost benefit of influenza, healthcare costs in Europe have been assessed as twice as high among influenza patients with complications as compared to those without them. And these complications are often caused by chronic conditions. Also, those at risk have greater likelihood of visiting a GP, as well as dealing with changes of hospital admissions caused by influenza. Last but not least, 1 in every 10 elderly hospitalized because of influenza will experience a loss of independence. Now, moving on to the Singapore government's investment in preventive healthcare, we can tell that the budget allocated for health promotion and preventive healthcare programs remains the lowest across the years, and most of the budget actually goes to the operation of medical institutions instead. So what are some actions that the government can consider undertaking in order to make funding more sustainable? So they can first strengthen their ways of working with the private sector. Many Singaporeans choose to utilize the service from public sector precisely because of the favorable amount of subsidies provided. It is therefore possible for grants and subsidies to be given to the private sector as a form of incentive for them to revise their high charges. Next, make elderly vaccinations mandatory, as the initiatives that we went through earlier remains as recommendations. Vaccination still remains as an option for individuals. However, when this becomes regulatory, all individuals who satisfy the criteria will have to comply. So the effect that we can achieve out of this becomes immediate. Here are some ways that we can undertake to outsource funding. First, perhaps we can have more partnership with insurance companies. Since medical checkup or screening are often included in insurance packages as a form of preventive checkpoints, I believe vaccines can also serve as a sort of preventive measure. Next, we can also attempt to increase the demand for vaccination by tackling the barriers of vaccination, as some experts have suggested in a study that was mentioned a few slides back. And how do we know whether these ways are effective? So let me first begin by talking about the feasibility and impact of these two methods. First method only targets a certain group of consumers. Therefore, it creates a market that caters mainly to consumers who values preventive healthcare. With that, the increase in vaccine uptake might not be as big as we would usually expect it to be. And as for the second method, the feasibility has already been piloted with a study conducted using point-of-care information interventions, such as flyers and posters. And the results were positive, as there was an increase in awareness and decrease in vaccination misconception. Therefore, such information interventions are likely to be contributing factors to an increase in uptake rates. And the overall effectiveness can be observed using the following indicators, such as insurance sign-up rates, annual hospitalization rates, and mortality rates for both influenza and pneumococcal disease. Now, as there has been limited amount of cost effectiveness of pneumococcal and influenza studies conducted specifically in Singapore, a research conducted has a model that is created to estimate cost and public health impact of children aged 17 years and below by using pneumococcal disease as an example. Although this study looks at children aged 17 years and below, this age group also happens to be significantly prone to influenza and pneumococcal disease as compared to elderly aged 65 years and above. Using a Markov simulation model populated for an economic evaluation in this study, values indicated in the last 2 points have shown that all pneumococcal vaccination programs were estimated to be moderately cost-effective in Singapore when herd immunity effects are included for those aged 17 years and below. Before I end, I would like to take this time to thank ADB Southeast Asia Development Solutions, EU-ASEAN Business Council, and Sanofi for putting this competition together. And of course, the judges for giving me this opportunity to present to everyone. Lastly, not forgetting everyone online who has been with me throughout my presentation. With that, I've come to the end of my presentation. So the last 2 slides are references, by the way. Thank you, everyone.
Thank you very much, Christine, for this inspiring presentation, and congratulations.
Thank you.
Now, to close off our event today, I'd like to invite Ada Wong from Sanofi, who will deliver her closing remarks and visions for maximizing the benefits of life course immunization in Southeast Asia. Over to you, Ada.
Thank you so much. First of all, let me congratulate Christine. I'm very impressed by your presentation and by your work. It's truly inspiring to see the action that's being taken across the region to increase the uptake of immunization. We're more than happy to be able to support this whole ideation initiative together with Asian Development Bank, Southeast Asia Development Solutions, and EU-ASEAN Business Council. Live course immunization has increasingly important topic following the COVID-19 pandemic. We've seen the importance of investing into preventive healthcare, making this kind of program accessible so that we can create resilient healthcare system and ensure no one left behind. Several countries in Southeast Asia has already implemented programs in order to drive the upticks and extent of live course immunization, which is very encouraging, but more needs to be done. Preventive care is widely recognized as the way forward to build a resilient healthcare system, and immunization is a crucial component to making healthcare more sustainable. In addition to preventing infectious diseases, immunization can also reduce the risk of health complications among the vulnerable population, especially those with comorbidities and decreased immunity. More than 20% of population in Southeast Asia will be age 60 and above by 2050. Innovation to prevent diseases and enhance health and well-being into old age are critical. The initiative proposed today Key is show how can we drive a real change in health economics while bringing to the forefront new solutions that can be implemented to maximize the benefit of life course immunization throughout the region. We hope that this webinar has sparked some new ideas for all, and very much look forward to seeing the initiative being developed further and make a difference.